Hello, my name is Oleina Dzhulai. My student's ID number 442870.
Hello, my name is Oleina Maja Toyosi. My student's ID is 457103.
Hello, my name is Sari Anggraini. Student ID number 468498. Thank you.
Hi guys, I'll be taking us through the process of donning and doffing. But first off, you have to wash your hand, which I already did. Then the next thing I'll go on with is to wear my cap. I'm wearing this because I don't want any air distraction or my hair dropping. So the next thing I want to do is to put on your gown. But before that, I have to sanitize my hand. Then put on the gown. Like this. And tie it around your neck. And make sure it's not too tight on you. So the next thing we have to go on with now is my eye protection. The next thing to do now is to put on the glove, but before that I would like to sanitize my hand again. And you have to make sure the glove is not too tight or too big on you, and make sure it overlaps on the gown, on the sleeve, like this. Go with the second one, like this, and make it overlap on the sleeve, this way. The next thing to do now is to go on with my marks, this way. And I have to make it cover my face very well to make sure no hair is coming out. We're done with the donning. So now I'll be going through the doffing part. But the first thing we have to do first is to sanitize. I'll sanitize my glove because it's the most dirtiest, and I take it off like this. And use this one to take off on the removed one and put it into the biohazard bin this way. The second thing I'll be taking off is my gown because it's the second dirtiest. I'll go this way. This way, and wrap it backward, and put it into the biohazard bin. The next thing I'll do now is to take off my eye protection. So this one is not disposable. I'll just put it in the bin to clean. And the last thing I like to take off is my marks. I'll take it off this way. Put it into the biohazard bin this way. And I'll sanitize my hand. And the last thing I would like to take off is my cap. Then I'll put it into the pyroazole thing. Also, and you can decide to wash your hand, but I'll just sanitize my hand. And we are done with the donning and doffing process. Thank you.
Hello, I will be demonstrating the sanitization and disinfection process. Before I started sanitization, I have to protect myself from infection matter. I have to wear my PPE. It should be mask, it should be goggles or face shield, it should be waterproof apron, and should be utility gloves. I have to protect myself from any sharp instruments and prevent injury. I have to wear utility gloves. And I have to work in good ventilated room, and the temperature should be between 18 to 23 degrees. And today I am gonna sanitize and disinfection 3 critical instruments. It's a surgical knife, surgical scissors, and tissue forceps. And to remove all debris and to prevent coagulation any body fluids, I have to rinse this instrument in cold water. Actually, we don't allow to dry any fluids on the instrument because microorganisms can hide under these contaminations and not be destroyed after disinfection. This is the brush. In real life, it's a wire brush, and I have to use the surgical soap for sanitization. And I'm gonna start the sanitization process. It should be cold water. I just rinse this instrument, put surgical soap, and now I have to clean all this instrument in both sides. I have to pay attention on any cavities, grooves, holes, and I have to clean in both sides. I have to clean here, here, and here. Pay attention any holes, grooves. You have to check this. After that, I again have to rinse this, and I have to dry this instrument into muslin paper or or free lint towel. And now we have to sanitize scissors. Again, it should be cold water. I have to rinse this in cold water, and just like this. If the scissors has any serration, I have to sanitize in the direction of this serration, like this, and after that perpendicular. And I have to do this in both sides, like this, and like this. All 4 sides. I have to pay attention if this hinge in the scissors, because in this space the blood can collect. I have to clean this very carefully and properly in both sides again. I have to clean handles outside and inside, again in both sides. If the scissors has some ridges, I have to clean this in both sides again. And I have to clean this handle outside, inside, and I have to rinse this water. And I have to dry this in these scissors properly. I have to leave this in open position. It is the right position for drying scissors. And the last one the same. It's a tissue forceps. It could be rinsed in cold water. And after that, I have to clean this properly outside, inside, and in both in both sides, in both waves, and inside, of course. I have to rinse this, and of course I have to rinse this, and I have to through this brush into biohazard waste. Now we have to dry this instrument properly. If we don't dry this instrument, in many videos show we can use paper towel for drying. If we leave some water on this instrument can rust and can get dull, and this water can dilute the disinfection, our disinfection solution, and make them less effective. I have to throw it through the biohazard waste. When I finish this process, I have to take away my dirty PPE. I have to take away utility gloves, just like this. Utility gloves, and and I have to take off my apron, waterproof apron, and I have to take off these disposable gloves to the biohazard waste. I have to wash my hands, and I have to put on the new clean disposable gloves. And now I have to clean all this. I have to clean all this surface with disinfection. I have to clean my utility gloves. I have to clean my waterproof apron, and I have to clean all these surfaces. It should be like a thin. All these surfaces, it should be thin trays, tables. I have to clean this properly. After that, I threw these wipes away, take off my disposable gloves, throw it away, wash my hands, and I have to put on clean and new disposable gloves. And I am ready for disinfection process. Now I have to take my clean instruments and put it to the container with disinfection. Because this is the critical instrument, we have to use the high-level disinfection is Sidex OPA. This disinfection don't need to be diluted. We just pour this in this container. We just pretend this is the Sidex OPA. The whole instrument have to be covered, and we can put lid on it. And I labeled this container. I have to write what disinfection we use, the date stamp of this disinfection, with what instrument we disinfect, my name and my designation, like MOA. Following the manufacturer instruction, we have to disinfect this instrument 12 minutes at temperature 20 degrees. After finish the disinfection, we have to submerge and rinse this instrument 3 times under warm water. Now I rinse just 1 time because this is a demonstration, but in real life I have to rinse this 3 times. And now this instrument ready to dry again. Before wrapping this for sterilization, we have to dry this instrument again to prevent any rust, corrosion, and any other, like this. I have to put this through the biohazard label, and now this instrument ready for wrapping. Thank you.
I'm going to wrap the sanitized surgical instruments now. Before that, I'm going to sanitize my hand. all the fingers I clean, and also my nails. After I clean my hand, I put on the gloves so my instruments are kept clean. Okay, now I'm ready to wrap my instruments. These are all surgical instruments. I will put on the cotton to these instruments so that the instruments do not poke into the paper. Oh, these instruments are put horizontally, and this paper are put diagonally. Right? So I put on the cotton like that, so it doesn't poke into the paper, and also it keeps the instruments clean and prevent from corrosion or rust. The same with the surgical scissor also, we put cotton in between. After that, we have two wrapping papers here. We will wrap it twice. The first wrapping
indicator.
Oh, and then after that, we put on indicator, chemical indicator, to make sure that it's sterile, to know that the instruments are sterile. So this is how we wrap it. We make sure that there's this on outside, so it's easy for the other person to pull it out when it's finished autoclaving. Face it that way, and then the second wrap, similar. Like that. Okay, there's this, so it's easy for the other person to pull it out. And then after that, we will tape this, wrap it around. Make sure that the tape is easy also for the other person to pull it out later. And then after that, I will put on the name of the items, the instruments inside. This is called surgical pack. Surgical pack. So I will identify this is a surgical pack, and I will put on today's date and my initial. Okay. Now we are done with the wrapping, and now it's ready for autoclave.